There are two main areas to focus on before coming into hospital for your joint replacement. The first is ensuring that you are physically fit for surgery. The second is ensuring that you have considered all the practical elements of managing at home after surgery and what practical support you may need during this time. As part of your preparations for having an operation, you will be asked to attend a pre-operative assessment clinic. The Pre-Operative Assessment Clinic is a nurse-led clinic that specialises in preparing patients for surgery. Other members of the clinical team that you may see on the day include the pharmacist and a representative from the therapies team. Some patients with a more complex medical history may also see an anaesthetist in clinic. Your pre-op appointment will usually take place approximately 4 to 6 weeks before surgery and take about an hour. If you cannot make your appointment, please contact us. Failure to do so may result in a delay or cancellation of your operation. Please bring with you clinic letters from other hospitals which detail your care, treatment or investigations. Reading glasses if you need them, as you will be given some forms to fill in when you arrive. Any questions or concerns ideally written down so that we can answer them. A printed copy of your current medicine prescription or the tablets you are taking, including their strength and how often you take them. Our aim is to ensure that you are medically fit for your joint replacement surgery. You will be asked to complete a questionnaire about your general health, fitness, previous operations and illnesses, and your medication history. The staff will go through all these answers to the questions with you. A swab will be taken from your nose and groin to test for a bacteria called MRSA. If this test is positive, you may need to be treated for this bacteria first before surgery can go ahead. You will have your height and weight recorded, your blood pressure checked, and have bloods taken. The blood is used to examine your general state of health, to determine if any signs of infection are present, or to determine how a specific organ, such as your liver, is functioning. Other tests that you have done before your operation will be determined by your age, your general health, any illnesses you have, or any medication you are on. These tests may be done even if you appear to be healthy, to provide information about conditions that could affect the treatment you need. If we discover any medical problems that might benefit from further treatment or investigation before your surgery, such as high blood pressure or diabetes, a member of the pre-operative assessment team will directly contact your GP to arrange for you to have a GP follow-up. To reduce your risks of developing complications after surgery, we will discuss the following. Smoking. If you smoke, you'll be asked to stop smoking and given advice on how to do this. Even cutting down can help. Alcohol. If you drink over the recommended daily units of alcohol, you should aim to reduce this to the recommended daily amount. Weight management. If you are overweight, we will talk to you about losing weight. If you are underweight, we will talk to you about nutritional support. Try to maintain a healthy weight by staying active and walking as much as you can. Stay active by continuing your usual leisure activities as able and keep walking. The exercises in your patient information guide can be started before surgery. After your assessment, and if you are fit for surgery, you'll be given a date for your surgery to take place. You will be given instructions which you will need to follow on the morning of surgery. These will include which medications you can take on the morning of surgery and what time you should last eat and drink. It is essential that you follow these, otherwise your surgery may have to be cancelled on the day.